We have about 329 people in our ICUs right now across the county of San Joaquin. We've seen it peak as high as in the 340s, 350s. But the problem is that it hasn't really come down far from there. We've kind of plateaued at this very high number, and we haven't seen it significantly drop for several weeks.
You seeing any end in sight? Because we see that, Sacramento region, the stay-at-home order has been lifted. What is kind of the difference between their region and what we see here?
So I'm not sure if we're seeing an end in sight quite yet. The fact that we're plateauing and not continually rising with our hospitalization and ICU rates is a good thing. But as I said, it's plateauing at a point that's a little uncomfortable. We need to bring it down. We're still finding cases from New Year's parties and gatherings, and we're still expecting that in the next couple of weeks, things that happen over New Year's will result in more hospitalizations in our ICUs. And we're different from the Sacramento region. We're the San Joaquin Valley region where a lot of our hospitals are full, and we're at 0%. And the county of Sacramento happens to belong in a different region where a lot of their hospitals still have space in their ICUs.
Do they have more hospital space compared to our region overall?
They have I don't know exactly how many more beds they would have, but I know they've had more ICU capacity. And what the state is doing is not only looking at their ICU capacity, but making calculations as far as how much capacity are they predicted to have 4 weeks from now. So looking at the Sacramento region's numbers, they're predicted to have 15% ICU capacity because they're starting to see some drops in the case rates and the hospitalization rates there.
So, what is your advice right now to the public? Obviously, a lot of people are getting pandemic tired. That's been going on now for several weeks. What do you say to those folks?
I know that everyone's so tired of this, and it's affecting people financially, physically, mentally, and this is a hardship. But pandemics don't happen for years and years. So this is quite unique. And just remember that we haven't had a pandemic for over 100 years. So that's how unique this situation is. So please bear in mind that we're living through something really hard, but we're going to get through it. And what I would ask the public to do is please wait. And when it's your turn to get the vaccine, please get it.
Fine. One more question. I'll let you go. Is there any sort of specific trend that you're saying that is going up or down, like a segment of the population? Like we've done many stories on this Hispanic population, how their numbers are higher than other areas. Are you seeing any positives anywhere in some of the numbers?
It's pretty much trending the same as it has before. We're very worried about our Latino Hispanic population. They might not make up all of the confirmed cases, but they seem to be making up more of our hospitalizations, unfortunately. And we're still seeing that our older generations are really abiding by the rules and staying at home. And it's our younger adults that are having a higher case rate, less severe disease. But we believe that a big reason for transmission is that a lot of these younger folks are still working, still essential, and still out there transmitting.